Welcome to Live with Hillsdale Hospital. Today is June 18th. Wow, the month is flying by, isn't it?
Absolutely.
My goodness. And we're excited today to bring you, our listeners, our friends, our supporters, the most up-to-date information regarding healthcare right here in your backyard in Hillsdale County. It's great to have you. It is even better to have a very special guest in the studio today, Dr. Jumaa. Let's talk a little bit about your background first and introduce you, because this is your first time in our studio, correct?
Yeah,
It's great. And first time in Hillsdale, is that correct?
First time.
This is exciting. So we've got our first victim right here. First time Hillsdale Hospital in the studio. We're here to bring information to our listeners about what type of collaboration exists between rural hospitals and big tertiary centers. And you're a tertiary center because you're with a major hospital system that's based in Toledo, Ohio, ProMedica, but also has offices throughout Michigan and Ohio. Want to talk a little bit about that, but before we do, let's talk about your background. Give us a little overview of yourself and what you do.
So I'm a neurologist by training. I trained at the University of Pittsburgh many years ago, and in 2012, after I finished training in neurology and then vascular neurology and then interventional neurology, and I do have several certifications and taking care of patients who are critically ill in the neuro ICU, and then doing interventions on patients who need treatments for cerebrovascular conditions. So I've been with ProMedica since 2012. I also teach at the University of Toledo, so I'm a professor at University of Toledo. And I started in 2012 with my partner, with Dr. Zeddy, and we actually established the stroke program. That was really a big gap in care in the Toledo region.
Were you private practice then, or were you employed?
No, we were in the same.
So you were
employed
employed
in the same model.
In the same with
the same model.
Okay, and then you decide we want this telestroke model.
Yes. So we, when I was in Pittsburgh, telemedicine was picking up. That was back in 2006. This is how old I am.
Right. So, we're doing the math.
So
right?
So 2006 is when people started using telemedicine. Technology became advanced enough, whether it's your wireless connection or your cell phone connection.
Right.
So telemedicine became a thing, and at that time we were using a very rudimentary system called Polycom. You remember Polycom?
I do.
Probably.
Yeah, conference calls.
A lot of administrators use Polycom, but it wasn't made for medicine. So at that time, we were expanding very quickly. And neurologists around that time, this is the peak of publications about this topic back in 2006 or 2007, realized that neurological examination can actually be done very efficiently without touching the patient.
Yeah.
So all you have to do is watch how they're doing, ask them to do a few things, move their eyes, move their lips, big smile, move their arms and legs, and with some support devices and a person at the bedside, you can actually get a pretty thorough neurological examination.
Yeah.
And you're able to diagnose patients, especially in urgent or emergent cases. So as soon as we came to Toledo, we brought this technology with us.
Yeah.
And the idea was to expand this tele footprint. The reason it's needed is that there's a really major shortage of neurologists in the country.
There is. Yeah.
I think we're training a lot of people, but we're not meeting the demand of all the rural communities.
Correct.
So it's very hard to find neurologists, even in medium-sized cities. Honestly, they're booked to 180 days out, and there's a major shortage at this point. And the American Academy of Neurology is aware of this shortage, so there's we're advised to increase training physicians, and I'm a program director of a fellowship in Toledo, and we're increasing the number of people that we're training, but at the same time, to meet the immediate need. The need is not only just the fact that we haven't trained enough physicians, it's just the fact that neurological diseases have gone from being completely vague and untreatable to having a very high rate of treatment.
Yeah.
So now we understand multiple sclerosis a lot better. Yeah. We understand stroke. We have really good treatments for stroke, some newer treatments for dementia.
So patients are really flocking to
patients
neurology.
All of a sudden are flocking to neurology.
Yeah.
Diseases that we used, primary care physicians used to diagnose and say, well, we know what you have, but we don't have a treatment for you. Now all of a sudden they're treatable conditions. And most primary care physicians don't want to deal with them anymore. They're
Absolutely.
Well, you may have this, but it's better to go see
complexities of it go over here. I think one of the issues for us has been in rural America, just just not even talk about Hillsdale specifically, but rural America. It's difficult to recruit any provider, primary care,
Right.
let alone specialty care. So we have struggled as a hospital system to have neurology and to have a neurologist here. Number one, the cost of a neurologist in a community where it's high Medicaid, right?
Right.
And unfortunately, not the volume to support a full-time program. Many communities walk away from that service. We had it at one time. We had a full-time neurologist.
Right.
And we just were at a situation where we could not afford to have neurology any longer. And it was a challenge. So what I did is we had a partnership.
Right.
So speaking of tele, we had telestroke with you.
Right.
So remember those days early on?
We started this partnership many years ago when we got to Toledo, almost in 2012. I think at that time we reached out to you.
You did.
And we told you what we have in terms of the newer technology. Moving from Polycom, now we actually use a software called Video, VYDIO.
Right.
And it's a really good software in the sense that it uses low capacity of streaming to be able to continuously examine a patient with video and audio. And we have a special cart in the emergency department where as soon as the patient arrives to the ER, you guys contact us and we're able to log in and help the patient out and examine them. So you're really having a very advanced, subspecialty trained neurologist available for you within minutes.
Right there. Seconds at times.
A phone call away.
Absolutely.
Really. And the call doesn't go to our pager, it goes to our cell phone.
It goes right to the cell phone.
So they call us on our cell phones. We're like, okay, we're going to log in a couple of minutes. And so for stroke, there are three components. So I'm going to focus on stroke for a little bit now, and then we can talk about the other components. So for stroke, we really immediately available. We are able to see the patient, do a quick neurological examination, understand when their stroke symptoms started, what kind of treatments they have, and then make a decision about thrombolytic medications, which is a clot-busting medication. And then we decide who needs to come to us and who can stay. The goal is to keep people in their community. There are not enough beds at the tertiary care centers.
Right.
And most patients, obviously, it's in the best interest of any patient and any family to stay in their local community. So when we look at our numbers, 75% of patients we examine end up staying in the local community. And that's the sole purpose of this service. The idea is to keep people locally and be able to take care of them locally. So we see them emergently, and the ones who need to be flown in, they would come to us and we would apply the acute treatments, which is an interventional treatment in many cases. Or if there's a brain bleed and there's a need for a surgical treatment, they go directly to the operating room. And the ones who stay locally, we actually round on them the next day with the camera. So the same camera, we take it up to the floors and we're able to round with them. And give some support to the admitting physician to tell them what to do in terms of prevention of stroke down the line. We also, as part of this, are utilizing an artificial intelligence software called Rapid.
Yeah, that's something new.
And this is something new.
So talk to us a little bit about that.
So we deployed this, I think, in Hillsdale in 2022, I think, is when we were able to get it. And the software has been around for maybe about 18 years. And it's been evolving. And this is work out of Stanford. They were able to show that rapid analysis of, pixel to pixel comparison of the brain or the blood vessels, or what we call CT perfusion, which really allows you to see which parts of the brain are not getting enough blood flow. That those studies can actually support your decision and allow you to do, faster treatments for acute stroke and to have better outcomes. Okay. So, as soon as the scan is completed in Hillsdale, I actually can see it on my phone without patient identifiers. So it's perfectly HIPAA compliant. I can see it on my phone immediately within a couple of minutes. Okay.
It's incredible.
Many times we actually see the scan before we get the phone call.
Incredible.
So we call you and say, hey, you have a patient having this issue. And then we're able to communicate with the emergency department physician. And, before this was available many, many years ago, by the way, this Rapid software has been an essential component of many of the major clinical trials that actually have defined acute stroke care in the last 15 years, whether it's interventional treatments or thrombolytics. So, Rapid has been in almost every study. So, it's a huge advantage that we have Rapid available. It really facilitates us being able to see your imaging and then rapid decision making, and then the artificial intelligence component actually does most of the work for us. So we're able to compare right to the left side, back, front to back of the brain. So the pictures are very comprehensive.
And what's impressive though is having this technology and availability, patients would be diverted in the field.
Yes,
and they would
absolutely.
be going to further distances to go to a tertiary
Right.
center. Here, closest aspect is Hillsdale Hospital. Everyone now knows in ambulance services, we have stroke network,
Right.
patients brought in. Obviously, the triage happens. You can administer TPA, whatever
Right.
you need to do. Time is tissue, we say in this industry,
Exactly.
right? And we can stabilize a patient. The patient may, in fact, be transferred out of Hillsdale. It may
Right.
require that.
Right.
But in many cases, we're able to take care of that patient right at the onset and be able to resolve some issues. And
Yeah.
you're right there on the other end of it. That's the beauty of it.
Definitely. And that's a great point because, this question has been studied pretty extensively in our field. So a group in Barcelona in Spain looked at this specific question: is it better to divert patients to a tertiary care center that could be more than half an hour away, or is it better to take them to the local hospital and give them thrombolytics and stabilize them?
We know what
and then
that is.
Fly them
Yeah.
over. And the answer was that it's actually better to go to the local hospital.
Absolutely. Stabilize
If
the patient.
the local hospital is more than half an hour away
Correct.
from the
Correct.
tertiary care
Correct.
center. If it's only a 10 minutes
Then
difference,
that's a different.
then
That
makes
is
it
different.
that's a different
correct.
story.
Yeah.
But that's the stroke component. So we've had this great partnership for
Yeah.
many years
Yeah.
in terms of collaboration in the stroke network,
Yeah.
and we always give feedback to the ER physicians
Yeah.
and tell them how we did with a certain patient. We send people back to their community, to this area to
Yeah. And you do a
to
wonderful
get
job at
subacute
that.
care.
Patient returns back
Right.
into primary care.
Right.
Receives the testing that can be done here at Hillsdale Hospital. That's the beauty of our friendship.
Right.
In as much as we look at it, is that the opportunity for the patient to come back.
Right.
Then there's a collaboration. Let's talk about that
Right.
because time is of the essence here. We really want to get to the heart of some matter.
Yes.
We have a wonderful collaboration. So what worked well was our relationship that we had in terms of telestroke.
Right.
So we're thinking, all right, what else can we do at Hillsdale? And we started to venture down some other areas. In fact, Dr. Mooch is here. She is an ENT that works with you at ProMedica, and she is here once a month. She has a provider that's here once a week. We have a great relationship. And so then we look at, all right, what other type of relationships can we have with ProMedica? And so one of those were oncology.
Right.
And now we have an oncology program.
Correct.
Then we're venturing into new areas, and that's in neurology.
That's a neurology.
Because neurology is an important service for our community. Obviously, as a neurologist, you know the value of it. But let's start there. What type, so when we say neurology, what type of patient are we talking about? And why would someone go see a neurologist in Hillsdale County?
Right. So maybe about 20 years ago, neurology used to be general neurology. That's all you would get. You would get a general neurologist who would see all patients, whether they had a stroke or they had memory issues or they have multiple sclerosis or autoimmune diseases. And then the field really expanded very dramatically in the last 15 to 20 years. So now majority of neurologists in the country are actually subspecialized.
Okay.
So I'm subspecialized in cerebrovascular conditions. That's all I see.
That's all. Okay.
We have a group of close to 30 neurologists, and each individual, except for 2, are actually subspecialized.
Okay.
So we have multiple sclerosis subspecialists, we have movement disorder
It's incredible,
subspecialists,
though.
we have dementia subspecialists,
Wow.
we have neuromuscular subspecialists, we have people who are specialized in epilepsy, which is a big one, and we have four physicians specialized in epilepsy. So the field has expanded so much, and quite honestly, like even people who have done, I trained in neurology, finished my training in 2008. I don't claim to be well versed in multiple sclerosis, for example, because it became a subspecialty on its own. I focus on my field.
But a colleague
of mine will take care of
Absolutely.
this. So the idea, the growth that we had, the success that we had in telestroke, we expanded that to teleneurology in the hospital to be able to help with other patients who don't necessarily have a stroke, but they have neurological conditions. And then we say, why don't we take this to clinic as well?
Yeah, take it to the outpatient.
So we took it to the outpatient, and then we started this program, which is a clinic-to-clinic teleneurology support.
Right.
And it's a regular consultation.
Yeah.
Patient comes here to Hillsdale Hospital, and they get checked in. Their vital signs are checked. They sit in a room, and then we log in with a nurse practitioner with neurology, and then if there's a need with a subspecialist, patient gets examined. We take history, we review their medications, we examine them with help of someone at the bedside. And then we give them a treatment plan.
Yeah.
Many times tell them what imaging they need. Is there a need for a visit for complicated cases to Toledo, potentially? But the majority of patients would actually stay locally, and they can get a really solid opinion
Yes.
on what's going on with them in their clinic locally.
Yeah, there's a lot to unpack because number one, just getting there is traditionally is a referral from a primary care physician.
Correct.
Who says, you know what, you really need to see a neurologist.
Right.
But there are people that can just walk in, obviously, after they make their appointment and can be seen by a neurologist. But historically and traditionally, it is a referral process. So what happens is the patient in Hillsdale County will get the referral from their primary care saying you really need to see a neurologist. And then we provide a call number where this patient can be obviously referred to, which is ProMedica Neurology.
Right.
And in our collaboration, you place out at Three Meadows, which is where we're located, in the suite where Dr. Mucha is. So it's Dr. Mucha, oncology, and now neurology. Very excited. So two services, oncology and neurology, are both virtual. But the beauty of that is that you have someone there as really a shepherd of the program that's walking the patient through. So they're not just showing up. You're not just showing up to a TV. You're not just opening a door by yourself. You're being checked in, the screen is turned on, and then you're consulted with a nurse practitioner. Now, the nurse practitioner works under your purview in collaboration, correct?
Correct.
And what happens in cases where maybe the physician's assistant, the nurse practitioner says, you know what, I'm not comfortable handling this myself. She has access to a whole team.
She has access to the subspecialist, so the nurse practitioner would be the front line, and then if she decides that this patient needs to be seen with a multiple sclerosis specialist, for example, then she would schedule another appointment and would be a follow-up with a subspecialist. A lot of the consults, especially the walk-ins that we get in neurology, are headache patients or things that are easy to resolve, back pain, neuropathy. Those are relatively easy to resolve in one visit. But then if the nurse practitioner feels like she needs to pull one of the subspecialists in, whether it's an epilepsy case or a stroke or multiple sclerosis, then we can arrange that in a separate visit. As we grow in this program, the goal is to actually do both visits on the same day. But we're trying to understand the volumes and trying to figure out how those visits will work and make sure that it's perfectly convenient for patients.
Yeah, and it's been very popular. One of the concerns that has been raised every year in our community needs assessment was access to specialty care, specifically neurology was an area, because when we lost our neurologist, patients who lacked transportation could not get to a neurologist 50 miles away.
Right.
And so bringing this technology and this service here is incredible. I want to thank you for that.
Oh, absolutely.
Because we have the wealth and the historical perspective of a tremendous amount of highly skilled and trained neurologists in specialty niche areas. That's to the benefit of my patients who, you go into a rural hospital community and you have access to 15 neurologists.
Yeah.
I mean, that's unheard of.
Oh, that's
and
great.
so it's incredible, the depth of experience.
And Shannon Hamilton at the front line, she's the nurse practitioner.
She's the NP that does it.
Program. She has been in neurology for 10 years.
That's incredible.
She has great experience, and we trust her completely.
She's well received by our patients. I've already heard very positive comments.
That's great to hear.
And we want to build the program. So how we want to do that in collaboration with ProMedica is to work with you, the patient, to make sure if you have a need, talk to your primary care physician. They'll talk to you. But understand you do have choices. If someone tells you you have to go to hospital X and avoid Hillsdale, that is not true. You as a patient can drive that decision. You can say, no, I heard on a Facebook, on a live event, that in fact Hillsdale Hospital is now offering, in a collaborative agreement with ProMedica, services for neurology. All you have to do is say that. They will then set the referral process up for you to be seen by at first the nurse practitioner. And then if it's something that requires additional care and follow-up, as Dr. Jumaa said, that can be done either here at another virtual visit, or there are times we have to recognize this. We may send a patient to Toledo. We have to be aware of it.
And this is very important to understand that we cannot solve everything by telemedicine.
Correct.
But telemedicine is really an access service. It allows patients to not to have to drive for an hour to go see a neurologist. So we're able to resolve probably about 75 to 80% of conditions via the service, but there's some patients who will have to drive to Toledo for advanced testing that's not available locally, or seeing a subspecialist who needs to see them physically and do a face-to-face neurological examination, or if the family decides that they would like to sit down with the physician and talk in person, that's also available for us.
So let me ask you this question. What other discipline plays very closely with neurology and specialty care? I mean, do you work with wound care much? Do you work with oncology much? I mean, who are you working with?
So, I mean, neurology, really, because of all the subspecialties that I mentioned to you, they interact with other specialists very, very frequently.
Yes.
So we, because I'm a cerebrovascular specialist, I work with the vascular surgeons and the cardiologist very, very closely.
Sure.
So if the patient, for example, has a brain aneurysm and an aortic aneurysm, then we do have a team to take care of both.
Right.
And we would coordinate care. Many of our patients with strokes, for example, have structural heart issues.
Yes.
So we work with a structural cardiologist to be able to prevent a subsequent stroke. The multiple sclerosis physicians work with the rheumatologists because they take care of autoimmune conditions, for example. People with neuromuscular conditions very frequently need some support for orthopedic care.
Mm-hmm.
Recently, as part of the growth in our group, we actually started a subspecialty ALS clinic. ALS is a very morbid
is that
disease.
Right? Wow.
And the idea is many of our patients drive in from 45 minutes away or 1 hour away. So we decided to bring all the specialists to do a single multidisciplinary clinic where the patient would come in and spend about 2 hours with us. The specialists are spread over 5 rooms, so they're able to see a neurologist, a respiratory therapist, and a pulmonologist, a physical therapist, a speech therapist, and then social support.
What a continuum
of care.
Visit. That's amazing.
So, a patient would come in, spend half a day with us, and then they would go home. And they would do this routinely as their, disease is changing and evolving. So, it's all, the concept with those multidisciplinary clinic is patient convenience, really. Instead of having people bounce between different clinics and, schedule care that can take, we all have been in this position.
Yes.
And it's absolutely painful to coordinate care over 6 to 8 weeks.
Absolutely.
So, the goal is to, facilitate really easy care for patients where, they would get the answers that they need pretty quickly, and then also conveniently with the highest level of expertise.
Yeah, it's a difficult time in the lives of our patients when they're sick already. They don't know how to navigate this very complex healthcare system, but having this opportunity in front of them is you coordinate that care. So if it requires additional care with other subspecialties, you're able to help coordinate that. That's the beauty of it for you as a patient, is it just doesn't stop with neurology. It just doesn't stop with oncology. It just doesn't stop with ENT. We have this beautiful opportunity to work together to ensure that the patient, from beginning to end of their treatments, of their diagnosis, are taken care of. And we have access. The other beauty of this collaboration is that the patient comes back to Hillsdale, which is where patients want to be for services that we can render. We have orthopedic surgeons. If we have it, we will do it here. If not, in this, we can then form the partnerships that are necessary into the future. And the opportunities that exist for our patients are endless. They really are. But we start with the collaborative approach of, all right, how do we best serve that patient in the clinic? Telemedicine, it's been beautiful from ProMedica to Hillsdale. I started it 15 years ago. 2 years into my tenure here, I was able to get telestroke here with you. And, then we had a little, you didn't buy me flowers, so we had a little breakup. And then, but we're back together, and life is very good. And the patient is well cared for. So we're the first stop historically when an ambulance will drop that patient into the ER. And then now we can just link up with you. We were doing that on the inpatient side. Now we have the access to the outpatient. So last question for you. If a patient wants to call the office or be seen, they can do that by going to Three Meadows, but before they have to make an appointment, right? So is there a site we can give them, a number we can give them?
Yeah, so the ProMedica Neuroscience site is available. You can find all of our information.
Very good.
Just Google ProMedica Neurosciences and
you'll see all the faces and people
all the faces,
and disciplines.
The specialists, everyone that takes care of patients. And the phone number is really we have a single phone number clinic with a lot of people triaging patients to make sure they go to the right specialist. So that number is 419-291-3900.
Okay, we'll put it in the notes for you.
So you call that number, you tell them that you're from this area and you would like to be seen at Hillsdale Hospital, and and then they take care of everything else.
Dr. Jumaa, it is an absolute pleasure to have you in the studio. Questions typically come after our events like this, after live events, and we'll get you the questions if
For sure. Yeah.
patients have specific questions. Are there any specific today on live? None right now, but if they are, we'll get them triaged over to you so
That's
you
great.
can address those for us. I appreciate the opportunity for you to be in the studio, number one. Number two, for your steadfast devotion and care of our patients, because it's like family, right?
Absolutely.
When we send someone to you, we want to make sure that they're well cared for.
Definitely.
And I have great knowledge in knowing that you take great care of our patients. And I want to thank you for that.
Thank you. I appreciate it. It's been a very successful relationship,
really has.
collaboration. And,
Yeah.
we look forward to continuing to grow this.
Well, thank you very much
Thank
for
you.
being here today. It's been great. And for you, our listeners, thank you for joining us today. If you're looking for any support services, such as opportunities to see a neurologist, an oncologist, or any other ologist, we got it right here at Hillsdale Hospital. We'd love to be able to take care of your needs. And that is the strength of this hospital. It is a success of Hillsdale Hospital. Every patient, every time always is our focus, that every patient, every time you walk into these doors, that we're focused on you to provide the best patient care possible to you. And then beyond that, it's you entrusting those services to us, and that we return that at your high expectation of customer service. And so we would just ask that as you speak with your primary care physicians, that if you have a need for any of these services, you have an option to utilize Hillsdale Hospital. Other opportunities that exist, maybe you just say, I want to join a winning team and I want to work for Hillsdale Hospital. Absolutely. USA News and World Report. We've got top places of America. We have all kinds of designations among staff who actually take the surveys themselves and say it's a great place to work. We don't pay for that. They say it. This would be a place for you. We have over 40 open positions right now. You can go to our website, hillsdalehospital.com, join a winning team. We take the opportunity of investing millions of dollars back every year in staff education and community education to support our team here who want to advance. Maybe you're looking to stop a career and to start a new one. We're right here, right in your backyard. We'd love to be able to have you. So look at our website under the careers tab. There's 40 open positions today of places that you can join here, whether it's at the main campus or one of our satellite campuses. We'd love to have you. Also, if you're looking to make a donation, we're a non-for-profit. We'd love to have your donation. Even though we completed our $1 million campaign a few months ago, we still would love to be able to hear from you. If you want to designate a gift, whatever department, whatever purpose, and for whatever reason, we will take that donation, and you can actually do it online now. You can go right to hillsdalehospital.com, and then there's a give tab. So this is a functional website for you, and you can also find links to very popular podcasts, such as Rural Health Today, which is wherever you get your podcasts, you can download that. But that's our national healthcare podcast. Every week we talk about the challenges of rural health in this country and what we're doing to try to solve some of those challenges. No greater challenge has existed than it did on Monday when the Senate voted for these very terrible, sweeping reforms to Medicaid, in which it's going to remove tens of millions of dollars from local hospitals, billions of dollars from Michigan. In fact, the projection is now over $2 billion. It would cost Michigan to try to fund what the federal government's trying to cut from these programs. It's very dangerous, folks. We would encourage you to be advocates for your local healthcare, your local hospital. Speak out against that. These are devastating and dangerous cuts that are being proposed both in the House and the Senate. We need your support. We need your voice to say we need our local hospital right here in Hillsdale and hospitals across the country. We highlight and we elevate issues like this on our national podcast, Rural Health Today. Wherever you get your podcast, please subscribe, download. We'd love to have you as part of our team that listens every week to some of the challenges that we're facing. And then we're on WCSR 92.1. We're on Buzz Radio, all those places you can find what's happening in Hillsdale County every week. We'd ask that you tune into those places. Until next week, stay safe, stay healthy, stay Hillsdale strong when you choose Hillsdale first. Thanks for joining us today.